Hello again, welcome back, and today we're going to talk about the eyelid. We're going to go over some structures that make up the eyelid, as well as a few pathologies that cause a red eye. So to start with, this is the eyeball in the middle, and we have the frontal bone and maxilla bone above and below the eye, with some eyebrow and eyelashes. And the orbital septum here is what separates the orbit and the eyelid. So it's particularly important when we're thinking about orbital cellulitis, which we will talk about later. And above the eye here is the levator palpebrae superioris, and it is the one that opens the upper lid with the superior tarsal muscle, otherwise known as the Muller's muscle, and it is innervated by sympathetic fibres from the superior cervical ganglion. And then moving on to the above the eye is the superior rectus, which elevates the eye and adducts it and causes intorsion as well. And below is the inferior rectus, which causes depression of the eye as well as adduction, but also extorsion. And now moving on to in front of the eye is the orbicularis oculi muscle, which does the opposite to the levator palpebrae superioris, and it has three parts. Palpable and orbital parts both close the eyelids, and then there's lacrimal part which drains the tears. And this muscle is innervated by the facial nerve. And now behind the orbicularis oculi are the superior and inferior tarsal plates. These are dense fibrous tissues which contain the meibomian glands, which are sebaceous glands. And we'll come back to that when we're talking about styes. And here is conjunctiva, and tarsal conjunctiva is also called palpable conjunctiva. So these are the structures that make up what we call the eyelid. And just for completion of the diagram, this is the cornea and the anterior chamber with the lens behind it. And then you have the optic nerve and the vitreous humor. And so to summarize, the layers of the eyelid consist of the skin and the subcutaneous tissue, makes up the outermost layer. And when I say subcutaneous tissue, what I mean is not the fats, but the connective tissues. The connective tissue is what makes the lids so readily distended if there's edema or blood, for example.
So what attaches here are the eyelashes, the glands of Moll, which are the sweat glands, and the glands of Zeiss, which are the sebaceous oily glands.
And then the next layer is the orbicularis oculi muscle that we talked about before, and then it's the tarsal plates with superior and inferior tarsus, and also this includes the meibomian glands. And then the fourth layer is the levator apparatus, and lastly the conjunctiva.
So these are the 5 layers of the eyelid, from the most superficial to the deepest. And in my next video, the eyelid pathologies, I will cover some pathologies that cause a red eye. That includes styes, chalazion, conjunctivitis, and orbital cellulitis, which is a big red flag. So now I'm going to go over some vasculature and innervation of the eyelid. So the eyelid gets its supplies from the ophthalmic artery, which is a branch of the internal carotid artery. The ophthalmic artery also gives rise to the lacrimal artery, which supplies the lacrimal apparatus, which we covered in the last video. The other supplies of the eyelid are the facial artery and the superficial temporal artery. Blood is then drained via the medial and lateral palpable veins. Innervation-wise, there is a sensory and a motor input. The sensory input is supplied by the trigeminal nerve, and the ophthalmic branch supplies the upper eyelid. It has 4 branches, one of which is the lacrimal nerve. The lacrimal nerve again supplies the lacrimal gland. The maxillary branch supplies the lower eyelid. The motor supply is carried by the facial nerve, which supplies the orbicularis oculi, the oculomotor nerve, which supplies the levator palpebrae superioris, and sympathetic fibres that supply the superior tarsal muscles. So just very lastly, I wanted to cover some causes of ptosis. So firstly, it can be caused by an oculomotor nerve palsy. Oculomotor nerve, as we discussed earlier, supplies the levator palpebrae superioris. That is the muscle that opens the eye. It also supplies superior rectus, inferior rectus, and medial rectus muscles. So the only muscle unaffected in a oculomotor nerve palsy is the lateral rectus, so therefore the eye will be looking down, and it also supplies the pupil, and therefore you will see pupil dilation in a cranial nerve 3 palsy. A tumour can compress on the oculomotor nerve. Other things are superficial causes such as orbital cellulitis and severe conjunctivitis because your eye wants to protect itself. Other things include trauma, either blunt trauma or penetrating injury to the levator, myasthenia gravis, thyroid eye disease, aging, which is actually one of the main causes because the levator muscle weakens when you age. Lastly, chronic use of contact lens because the contacts rub on the conjunctiva where the levator sits on, meaning the levator atrophies earlier than normal. That's it for now. Thank you very much for listening.